Guess what they're doing now? So you know how they gave people health care during COVID? Because they knew they invented the virus in a lab. And so they gave everybody, if you got sick with COVID, they would cover your health care bill. Nothing else. If you got diabetes, you're on your own. But if you had COVID, they'd take care of you. And so they expanded Medicaid for a lot of people. And now they're pulling it back. 15 million people could lose coverage as nightmarish Medicaid purge begins. And here it comes. Beginning on Saturday, states across the United States will start the process of stripping Medicaid coverage from millions of people. As we send $100 billion to Ukraine, we're taking health care away from the poorest people in America, or the second to poorest people, as pandemic-related protections lapse. Part of a broader unraveling of the safety net that was built to help families withstand the public health crisis and resulting economic turmoil. Medicaid's continuous coverage requirements were enacted early in the COVID-19 pandemic to help vulnerable people maintain insurance amid the health emergency, resulting in record high Medicaid enrollment. But at the end of last year, congressional negotiators agreed on a bipartisan basis.
There it is. That's how you know it's a bad idea.
To set April 1st as the beginning of the unwinding process for the continuous coverage mandates, which prevented states from conducting regular eligibility screenings for Medicaid recipients. So this started last Saturday, I guess. But at the end of last year, congressional negotiators agreed. No, wait, I just read this again, right? The bipartisan deal gave states 12 months to determine who is still eligible for Medicaid, but some states, including Arkansas and South Dakota, are jumping at the opportunity to quickly remove people from the program. Residents of the 10 states that have refused life-saving Medicaid expansion under the Affordable Care Act are likely to be hit hardest by the end of continuous coverage requirements, which the Biden administration estimates could result in 15 million people losing health insurance nationwide, including millions of children. Great country, huh? Great country. So 15 million people. And so, by the way, the Biden administration's wagging their finger at Republicans for this.
Bipartisan Republicans and Democrats,
right? So, but my point is, the Democrats had complete control of government for 2 years. Did they give people health care? Did they give them a public option even? No, they didn't. Okay. Because those states tend to make only the extremely poor eligible for Medicaid, they will have many people who make too much money to qualify for the government health insurance, but not enough to reach the income needed to get federal subsidies to afford health plans sold on the ACA marketplaces. The coverage the administration is counting on as the main fallback. The Health and Human Services Department has estimated that nearly 7 million people could be removed from Medicaid despite still being eligible due to what they call administrative churning.
What is it?
7 million people.
You're churning people right in the ass, huh?
People who experience churning.
I was churned recently.
I was churned. What happened to what's happened to your health care? I got churned. People who experience churning or coverage disruptions are more likely to delay care, receive less preventative care, refill prescriptions less often, and have more emergency department visits.
Yeah, no kidding.
One study found that unstable Medicaid coverage increased emergency department use, office visits, and hospitalizations between 10 and 36%, and decreased the use of prescription medications by 19%. Children with interruptions in coverage are also more likely to have delayed care, unmet medical needs, and unfilled prescriptions. For fucking children in the richest goddamn country in the world, run by billionaire oligarchs who'd rather make those kids starve.
Get them to a life of crime and get them in the system. The privatized system.
Privatized. Additionally, the boosted child tax credit expired in late 2021 due to opposition from Senator Joe Manchin, a Democrat, and congressional Republicans, resulting in a rapid surge in child poverty. Shortly before the expanded CTC, that's the child tax credit, lapsed, boosted unemployment benefits that helped millions weather economic chaos ended. As the pandemic era safety net crumbles, congressional Republicans are looking to roll back Medicaid, SNAP, and other key programs even further with spending cuts and punitive work requirements. We don't even take care of our own people in this goddamn country. We send all the manufacturing jobs to China. We hollow out our economy. We don't give people a living wage. Half the country can't afford a $400 emergency. 80% of workers live paycheck to paycheck, and then we fuck over the rest of them.
That should work out. That's great long-term planning.
And they're saying, well, this is fuck poor people.
But this is going to fuck. See, the poor people
this
still
fucks
get
the
it.
Working poor.
Yes,
these are the people who work. But we have such a nightmare of a capitalistic hellscape, predatory capitalism, that these people can't even afford. 43% of homeless people have jobs.
I saw somebody try to debunk the thing about the not being able to afford an emergency, and I swear to God, this was their debunking. Well, then they said they'd just borrow from their family or... Oh, well, what? I feel like an idiot for bringing it up. Just ask your mom. That's a real debunking someone had of that.
Wow. Go to jimmydore.com to see my new stand-up special, COVID Lies Are Funny. For only $10, you get to become a premium member, too. And come see us do our live shows. We're going to be doing stand-up comedy in Milwaukee, Nashville, Honolulu, Los Angeles, Northampton, Massachusetts, Syracuse, New York, Cohoes, New York, Hartford, Connecticut, Baltimore, Maryland, and more. Go to jimmydore.com for a link for all those tickets.